I'm very quickly going to call on our first speaker, who is Dr. Modupe Adedeji. She's a consultant obstetrician and gynecologist at the oncology unit of Lagos State University Teaching Hospital in Ikeja. She is a consultant obstetrician and gynecologist at J.A. Lashma Hospital at Ogba, Lagos. Dr. Adedeji is a member of the Redeemed Christian Church of God, Lord's Chapel, and she is serving in the medical and marriage counseling unit. She is happily married with kids. Please, my sisters, it will not be too hard to ask you to celebrate and welcome her as she comes up to give us her talk. Please celebrate her for me.
Good morning, church. I can see the people that I know. So, First Lady, I'm honored to be here. I'm happy to be here as well. I've been here before, as you say. Anytime Pastor Mrs. Omokorede calls on me, I know that yes, I have an assignment to carry out, and I'm happy that my name drops in her mind, and that is God in action. Yes. So I'm coming professionally, and I'm also here as a sister. As earlier presented, that I'm also a member of Redeemed Christian Church. That is our church. And let me save all the others. I will still say what I said the last time, that I miss you. Then Pastor Mrs. Agubiade too. Immediately I saw her today, I just ran to her. I'm not sure if she can remember my face very well, but I agree with the First Lady. Her charges in front of the altar, in fact, tears will drop, and to reminisce for a long time. So I'm happy to be here. Thank you so much. Yes, I've been here to come and talk as a doctor on silent killers, and I'm very, very happy that it was a wonderful thing, a wonderful topic to have been chosen. In fact, it is so important, very important to highlight, to talk about these things, because I'm happy for the pandemic in one way. I'm sure you are surprised that I said why. Because what it did actually was that it brought health to us and let us know that health in the medical way is so germane and so important. And yes, we don't usually want to talk about health. In fact, immediately we say health, the next thing is divine health. But I don't always hear divine finance. I don't always hear divine law. But immediately you talk health, it's always divine. And I understand why. Because it is only one life that we have. There is no duplicate. For instance, you are asked to go to jail, God forbid, in Jesus' name. At times, it may not be a death sentence. Even most times, it's not death sentence. But a second chance is usually presented. And that is, you go and serve so number of years or so, and you come back to your life and all that. Then even if it's finance as well, you can be poor today, especially in Nigeria, and the next week, or even the next hour, you just see that over $1 billion is in the account. I hope none of us is operating those kind of businesses. So that was one. But for health, if that life is taken away, I don't know how you can replace and all that. And that's the reason why I was so happy to also listen to our mommy this morning, because our sermon was also charging. But I would like to share the experience I had this week. It's as if God was actually, because I was like, this is a very simple topic. In fact, very simple for me. I'll finish it in so and all that. But I think God wanted me to take it more serious and more passionate about it, and even emotional. He spoke to me directly, truth be told. Today is Saturday. I almost lost my very good friend on Thursday. As in, appreciating life, that when you sleep, as in you close it. They taught me about sleeping as a topic in medical school. But you know, when you read, it's to pass the exam now. But when you start seeing practicals of it, then you are inside. What they told me was that something switches off in the brain for us to sleep. You know when that sleep is coming, you yourself cannot control it. And something switches it on for you to wake up. And that goes on from day 0 that you are born, 1 hour into the life that you are living, and on until the age that it switches off permanently. And that's what we call death. That was what my friend went through just 2 days ago. Well, she's on the big side, so I won't be talking about that a lot. I actually told myself I would try not to mention that, but that's dropped. Don't look at my stature, because that was part of the things I learned this week too. So she came to work on a normal day, and she quickly rushed out that she should go and drop her son for common entrance, extension classes, and all that. So she said the son is on the 2nd floor of the building. But she just noticed that as she was climbing, she was trying to catch her breath. And then, the next thing, by the time she opened her eyes, she saw people around her trying to resuscitate her. What happened to her? This is a doctor, and she's not a small doctor. She's a consultant like me. We all work in Lasut, endocrinologist. So she said what happened. They told her she just fainted. Obviously, the next person to call was her husband. So the husband too, apparently too, is a consultant in Lasut, luckily. When I left that day, another thing that when I went to see her that dropped my mind is that every woman should just marry their husband. If your husband comes at the age 20, congratulations. If your husband comes at age 30, congratulations. If your husband comes at age 50, congratulations. Just ensure you marry your husband. So, because my friend is living a second life now, and I'm sure by the time she's getting out of the hospital, she'll never be the same again. I don't want to prolong the story, because even the story is enough for the teaching of today. Abby? So, that's how her husband came to pick her at the son's school. Before she got into the car, she fainted again. So, can you imagine the word of doctors? Luckily, she came around. So, with that, the husband now took it very serious. So, thank God it was a place not far from Lasut that they were in. So he started calling in that his wife, and because of the position and everything, everybody ran out, was ready for her at the emergency. Lo and behold, getting to the emergency unit of Lasut, that's how she fainted. This time around, she did not faint. We declare somebody is dead when we cannot feel the pulse of the person again, when the person is not breathing again. The new thing I learned from my husband's friend, because he's a pathologist, his own idea is to be cutting dead bodies and opening them up and say, this is the cause of death. You know, most of us don't like it. When we say we have to do autopsy, say, oh, God has, what for? But his work is very important, and it became relevant on this day. So by the time they got into the emergency, everybody was ready for her, not even knowing that she was going to come in that state. There was no pulse, and she was not breathing. All this happened in a swift of some minutes. And the thing that touched me, that my friend, that's the husband who is my friend, said was that he smelled, flatulence. And that signal to him is on his dead bodies. When you have that smell, he knows that this person is almost gone or even gone. And the next thing that will happen is that you see wee-wee and poo-poo, that he smells that flatulence. And the next thing he could do was to jump on his wife's chest and press her. That's what we call CPR, cardiopulmonary resuscitation. I don't think any other doctor standing that day would have given that much of it, because he understood that this woman is gone and she has to come back. I can't live alone. I cannot live in this world alone. That was the extent of the compression he gave on the heart. And immediately, she jumped up. Everybody now took over. Anyway, when someone is dead, you cannot find the vein. It's gone. Everything collapses. They couldn't find her vein. The only thing was to get a vein in the biggest vessel on the neck. So when I saw it, I knew that, yes. I moved close to her. I'm trying not to call her name. The first thing she said was, Adupe, Moku, as in, Motiku, Moku se, as in, Moku ni dupe, Moku. She said, when she was going, the end of a film or a program, when they will be rolling the end of the program, she said it was going fast. All of a sudden, she just noticed that the thing was slow. And the thing now went dark. And somebody announced, you are dead. The only thing she had to start doing was begging God to please come back. God, please let me come back. God, please let me come back. My children, my son, my daughter, my husband, please let me come back. And when she opened her eyes, she saw her husband beside her. You can imagine what has transpired with old people. As I speak right now, she's still in the intensive care unit in Lasut. So we threw out a prayer trust. Everybody was praying because it was not yet over. And what was this problem? It was because she had clotted blood. I know everybody will remember COVID-19 vaccine. There are some situations that make some medical terminology popular in this part of the world. We've heard of cardiac arrest, have we? We know that very well. So we are hearing of clots now, that it causes COVID-19 vaccine causes blood clots. There are many things that causes blood clots, many things. So that was the situation here. She had a blood clot that went to go and block the vessels of her lungs. The only way I could describe it for my group of prayer sisters was to call it cardiac arrest, because that's when they will feel the gravity. But that was not really it. It was her lungs, and she couldn't breathe. And if you can't breathe, that means no oxygen in the whole body, and then that means every part of the body cannot work sufficiently, and she was dead for those few minutes. So the compression, by His grace, because it is God, it was not in any other person. So you don't understand when a doctor is talking to you about God. Do you understand? There are so many testimonies we stand to hear in church, and like, I carry myself off. Is it not that we gave chloroquine and she now felt better, that she's kneeling down there and praising God? It's God, though, because we could have given the chloroquine or whatever, and the person does not feel fine. Because, well, like, that compression that the husband gave, but supposing the husband was not available, supposing every other thing that they gave was not available, where would she have been today? Should have gone. Apparently, 2 days earlier to that, I lost my senior colleague. On the same scenario, he is 59. He went to work as in normally and did his consultancy work, saw patients, did surgery and everything. Everybody talked to everybody at work and said bye-bye, not knowing he was saying his last bye-bye. So he has a clinic in Surulere, and his house is beside the place too. So he went to his clinic too, saw patient, blah, blah, and resumed to his three-seater chair in the sitting room, not knowing that was the last time he would sit down there. Immediately he sat down, he just felt that he could not breathe. He couldn't breathe. He died asking for the drug. He's a doctor now, and the drug did not get to him. Even if he had gotten to him, there was no personnel that would have infused it. And I'll put my friend in that place that could have just as happened. So he knew what was wrong with him, but help did not come. So that means that it was time for him to go. That was his own time. Exactly the same thing, the two of them. So life is so precious, and that is why I will now move to my topic. I hope I've been able to develop some goose pimples on people's skin. Well, the reason why I'm saying the story is that most times we just see the patients and then we'll do what we can do and all that, and then at the end of the day, because that's what we do every day. I see dead body almost every day. I just say, the patient is classified dead. But this time around, it was somebody that was so close, and it made me, because I'm always interested in knowing what happens immediately after you die. Were you able to, investigatory some things? So, I just appreciate God the more and all that. So if we know that there are causes of death, then there are things that we can use to prevent them. We have no power over our life. But what God has done is to put some preventions within us. And as our First Lady also said, that we should help one another. Help is around you. If you are meant to have lived for 20, I don't know, if one dies, it's always said that it's your time to go. But maybe one is supposed to, we don't know, but you're supposed to live at 80, and because of one's carelessness, you died at 20. So that's the reason why I'm here. So I'm supposed to be talking about the silent killers of health. So what is silence? Silence. Supposing I say the music should keep quiet now. Can you please keep the music quiet just for some seconds? Okay, the fan is blowing. So let's assume the fans are not working. So that is silence. Okay, you can keep it up now. But do you know during that period of silence, there are activities going on? Even your thoughts. What's this woman saying? She just came here to scare us with her story. I beg you. Talk and let the people that will come and charge us with serious prayer come on to the altar. Things are going on in the mind, but there is silence. Is there no silence? It's also scary too. When we are mothers, Abi. When you are talking, I have a teenager now, I'm proud to say that. When you are talking to your children and you are hammering, trying to correct, and the next thing is that there's no reaction. Even though you say if you react, but you expect a reaction. Reaction to show that whatever you are saying got in or is going to be rebellious. But the person keeps quiet. Is it not dangerous? Is it not dangerous? The child keeps quiet. Is it not dangerous? So that's what I'm talking about today. So most of the ones that are very loud are the ones that are very diseases that are very loud are the ones that are easy to treat, easy to take care of. And that's the only reason why people will come to the hospital. So I also want to reiterate here that hospital is not for satisfying people dead, as I've said. It is not only for taking care of people that are sick, but hospital too offers preventive medicine. The only clinic that I know that is obvious to everybody that does preventive medicine that everybody knows is pregnancy, antenatal clinic. The only thing we do in the antenatal clinic there is to preempt problems from happening. But even our women sometimes, immediately you get pregnant, you just say, "Should you register? So have you registered for antenatal?" As if it's just a gathering, and it's actually a clinic to prevent what can happen. I'm sure when I say maternal mortality, our first lady knows what I'm saying. It's grievous. So the antenatal is so important to find out that something is about to happen and stop it. Let me know. I like giving an example. I saw my pregnant woman, my antenatal clinic too. Her blood pressure was 200, 110. Meanwhile, before the pregnancy, she has a normal blood pressure. Very normal. Nothing is wrong. Her pregnancy is already 34 weeks. Just 1 day more to be 34 weeks. I told her, "Madam, the reason why you have this blood pressure is because the placenta is reacting. And that's why the body is saying this baby must come out. But if we don't intervene, the amount of this blood pressure can cause a lot of things. It can cause stroke." Let me come out so that as I'm leaving, there are some things that you can take away. Stroke, that's of the head. Blindness. This is where our heart is. Our heart is not here. Heart failure. Lung failure. Liver failure. This is how our liver is. Our kidneys are at our back. Kidney failure. Failure. Not pass, so failure. That means it stops working. And many other organs I can call that you will not know. Just let's stop that. That is it. That is the worst silent killer in this life. In this life. And I told her that this one has a cure because the one that is outside pregnancy does not have a cure. That the cure for this one is to bring out the placenta, not even the baby. But how will I be able to bring out the placenta if I don't deliver the baby? My precious baby. So my baby will come out and be in the incubator. No, doctor, let me go home and spend another 3 weeks. At least by that 3 weeks, I read in Google that is when it is time. Madam, if you are going to choose between yourself and this baby, who will you choose? No, doctor, my baby, let me wait. There's no problem. Madam, do you have a headache? No, I'm asking about the symptoms. Can you see me well? No, everything is fine. Is your chest paining you? Those are all these, I'm giving you all the symptoms of when the hypertension is already terrible. I'm already taking one of the diseases I'm talking about. It is only when it is terrible that the sign comes. By the time your blood pressure is really high and you're having headache, that means that for those of us that are hypertensive in the house, I won't say we should raise up our hand because we don't want to raise it because we're in church. You just know that if I have headache, that means that my drug that I skipped my blood pressure. Don't use your husband to threaten us. Women, we are the neck. Is whatever we want our husband to, he will just stamp what we want. So it is you that is the problem. Eventually, let me cut the long story short. We eventually succumbed to the CS after 2 days. But thank God, the baby is alive. She's not in the incubator. Her blood pressure has come down. So I'm not a prophet of doom. So that is how hypertension is. I've talked about that in pregnancy. That's because that's usually my area. But it's actually a problem that starts, if it is in the family. It's a black blessing, is our problem. And the major thing is about, people will quickly say stress. But truth be told, if there's a family history, so that's why I agree to praying against generational issues. I agree to it. It can stop. It may not be your own portion. But that does not mean that you should not be watchful about it. If you know that, yes, there's hypertension in my parents, my uncle, then I should let me go to the hospital. Where people go to in this part of the world, is either pharmacists. They don't call it chemist again. Is either pharmacists. That's where they will go to. My tummy usually turns when I'm in the pharmacy, because I just see the pharmacist doing his role in a doctor's form that you don't know. Even me as a doctor, I don't know your role as a pharmacist. The only thing I can do is write drugs. You are the one that will let me know that that drug you are writing, it is too much, it can cause this. You help me to guide my prescription. So they will come, my body is paining me. The pharmacy will turn, you need paracetamol. My eyes bring now water. Come, eye drop. My leg, it was swelling. The two give lasers. At the time you are leaving the pharmacy, you may have gone to buy like 10 drugs for one disease. When you come and see Dr. Adedeji, I will just write one drug for you. You say that doctor does not know anything. It's the pharmacist that knows. Meanwhile, I have tied all those complaints together and given it one name. And that is the drug that you need for it. So that is by the side and all that. So by the time, I'm still talking about hypertension. So by the time the blood pressure is high, you just know. So I was talking about the causes. So it's in the family, it's a cause, it's a probable cause. We cannot tie our hand to say this is it. There's something we call essential hypertension. And it's the reason that if it is in the family, that you are prone to it, that is why we call it essential. Because we cannot really find a cause in the body. We are always worried when hypertension starts in a very young age. Maybe somebody in his 20s, for why? For somebody in maybe early 30s, we need to refine out what it is. And the major cause of that, or major predisposing factors for that, is the kidney. If the kidneys are malfunctioning for any reason, we'll know. And what happens? You've now asked this, see my MC, beautiful. I've been looking at her her skirt since. You now ask this beautiful looking woman that, why would she have hypertension? Not knowing, not you, that her mother has been giving her herbal concussion. Since birth, they will bathe with it, they will drink it as fine and beautifully as we are well dressed. There are people that have herbal concussion. When I say herbal concussion, I don't mean the one from Babalawo. It's all those mixtures now, that will soak and everything, that you don't know the quantity, you don't know the chemical, you don't know what is it. This person has been having that for a very long time, and he has even seen it that it's the usual thing. It's when you get married to this man that he will tell you that that's how my parents brought us up. Use it for my child. Problem has started, So at the end of the day, the kidney is breaking down gradually. It's from cell that will become tissue. From tissue, we become organ. From organ, we become system. Is somebody relating with me? That's how the body is formed. So it will start that destruction from the cellular level. Before it moves to the tissue, before it moves to the organ, and finally the organ will fail. So when I say liver failure, you can imagine the time the thing has started. So you can imagine. So most times when you say, but that's how they do. Sorry for all my vernacular. That's how they do, but I want us to let it enter our downforce. I'm always very passionate when they say I should come on the altar and talk about health and all that. So that by the time you are leaving, because it's so difficult to convince you otherwise. When you come, there's something you've been seeing, the whole of your family. They are even living up to 100 years. And this small doctor is telling me it's not okay. You will not want to agree. Then the habit of smoking, if people smoke. Women smoke, oh. We smoke, oh. We smoke. When I ask, do you take history of smoking? You now look at me as if do women smoke? Women smoke. Smoking is a cause. Alcohol, they have refined every type of alcohol now. Because maybe these Guinness people, those alcohols of the days, 3-3, trophy, I think they are finding out that they've bastardized them. So they have tried to now bring up other ones that instead of making it bitter, they will make it sweet. By the time you look at the bottle, you see 12%, 12.5% alcohol. And you are taking that almost every time. It's a culprit too. Some people, salt is never enough in their food. As soon as they put the food, there's no salt. From table salt, you put more salt in that. These are all factors. And the last one that I said everybody will be looking at me today is obesity. I'm not obese though, but I pick a bit. I was looking at everybody in church today, especially our first lady too. That, I told myself, look, you must do something about yourself. I'm so happy that the awareness of losing weight is there in Lagos. I don't know what is, maybe in Abuja too, but I don't know what is happening in all these other suburbs. Every time I still stay in Bagada. When you come out of Bagada, you see people doing workouts. You just see people doing workouts. That is the best life. That is it. It's very interesting. In fact, it's the time that you can also use for prayers. If you don't know how to speak in tongues, that's the time you can master it, especially if you are doing it alone. But for security reasons, it may not be good to do it alone and all that. Workouts. I'm doing it, I took a break. Immediately you take a break, you bounce back. It will be very difficult to start up again. But let me explain that fat. The reason why fat is everything about our health. I don't know. Should people like orobo chicken? I'm not saying the one they sell in Prince supermarket. In the supermarket. I'm saying the live orobo, if you can get it. Abi, for all these, when they are big enough. All these. So we cut it now for our jollof rice and all that. Can you see that if you are very skillful enough, you can squeeze all the oil and you can get as much as a bottle of chicken oil. Is it not possible? When you are getting the heart, at least you can identify some of the parts of the chicken. You see fat surrounding it that you have to peel it up. Abi? Even the gizzard, the same thing. Then around the meat too, your hands will just be filled with oil. I have been in an autopsy room to make a diagnosis of the cause of death of one very popular. The man was, this is the table, he was this big, as in he's lying down on the table, his fat layer. By the time we finished the autopsy, my hand was like cutting a chicken, filled with oil. All the organs are tied up. They cannot walk as they are supposed to walk. What is keeping us going is there's activity going on, pumping blood all over our body. So that fat, if it surrounds it, that means they are finding it difficult to pump. At the end of the day, there's a rate that blood is supposed to flow through the pipe. We have pipes in our home now. We are always very happy when we open the pipe and water comes out, shoom, you know. But if it's coming out slowly, something has blocked it. That is what is happening. If there's no more supply, that means you look at it, is the tap spoiled or the tap is bad? Plumber will come and plumber will say the tap is bad. Put it to human, the person is dead. That is it. So in order to reverse this, it just takes you to just exercise and diet. Exercise and diet. It is not starving. It's just for you to be very peculiar, very particular about what you are taking in. It is not starving. It is not that you should not eat. I don't know. You have to lose it. But doctor, I don't eat in the morning. In fact, by 6, I don't put anything in my mouth again. The person talking about this is about 3 times my size. I've tried my best. It's in the family. If you see my mother, that's how it will be all emphasis. Even you, the doctor, will be confused that how else do you want to talk to this woman and all that. There's nothing like inherited obesity. One can go down. You can go down. And he explains everything. It's even a cause of infertility. Do you know? Being fat is a cause of infertility. Immediately you lose weight, you get pregnant. One of the causes of infertility is obesity. So obesity is responsible for so many illnesses. I try to divide the illnesses I want to talk about communicable and uncommunicable diseases. Communicable diseases are those ones that you can get from some people. That's why our chairs are spaced out. COVID-19. Those are the ones that announce themselves. Malaria will announce itself. Boil will announce itself. Cough will announce itself. Fever, all these things I've mentioned will fever and to bring you to work. The ones I'm talking about that usually don't announce themselves are the silent killers, and they are the non-communicable ones. So I just talked about hypertension. Another popular one is diabetes. That is another one. I remember, I'm being personal here, when I made the diagnosis of diabetes for the first time with my mother. She called me that she's a retired nurse. Hello, Dupe, oh my God. Because she's my mother, and we have all been living healthy since when I've known her, very active, everything. Diabetes was the last thing in my mind. Then I've juggled it to our family says. There are many diabetic brothers and sisters that she has, but she has them as half brothers and half sisters. So I like our own main idigi, you know, our own main stretch. Our father and mother, they don't have, so like it can't be. So I told her, Mommy, maybe you have infection. No, it's infection. Let's see, maybe we should use some antibiotics. That's why it's not good, really, for a family member, a professional, to handle most of your cases, because they may take it from an emotional, knowing you too much, something they call finish, and would all want something bad to happen to you. They want something milder. So I went for the mild things like that. She said, okay. I said she should go and run tests and start antibiotics. Only for her to call me again later that day. Thank God that as in, I'm getting tired. That's why I said, I'm going to pick you. They brought her in tired. Tired, in fact, dry. Her tongue was dry and everything. By the time I checked her blood sugar, I said, that was what pushed me. It was 300 and something. And then you look at this daughter of just her size. I tell myself every time, this thing is in my family. Oh, I must watch my weight. I'm using myself as an example. So diabetes is there. It's a silence. Can you see the silence? And the thing has been happening. There are two types of diabetes. We have type 1 and type 2. Some are born with it. What is that? Insulin is a chemical that helps to break down our carbohydrates and everything. So if it's not available, the sugar is so available in the body, it's supposed to help us to move, but it's not getting what will help it make that happen. So it's just available in the blood and causing problems. So that's why you have type 2, which usually happens in older ages, and a factor for that is if it's in the family. And it's a genetic issue. So it's difficult to take care of issues that are genetic. The only thing is to manage them. So that brings me to managing hypertension and diabetes. There is no cure, really. And I believe very, very well in divine health. But it is just about life modification. That's what those diseases are all about. Because I don't understand why you buy a generator and you feel that generator will serve you till you die. Is it possible? It's not possible. Even a car, let's use a car too, that you use that same car. Let's say they don't change cars, nothing is in vogue. Yeah, you don't have to change for anything. It can't serve you. You have to service it. You have to maintain it. You have to repaint it. You have to change engine oil. You have to buy fuel all the time. Exactly how our body is. So when I said that people that are hypertensive should raise up their hand and they didn't, the first thing to cure, I've not started talking about my 2 minutes. Okay, the first thing to cure is, first of all, accepting the condition. Cure has started. Management has started. But if you continue to rebuke, I rebuke hypertension in my life, I rebuke diabetes in my life, problem, we might never get an edge on it. They said I have 2 minutes. It will not be fair if I don't talk about cancer. Please give me 5 minutes more. It will not be fair if I don't talk about cancer, because cancer is another silent killer. How is there silence? If you have any ailment that is giving you pain, take it from me today, that is not cancer. It is not cancer. Let me first of all liken it to fibroid. Fibroid is not cancer. It's just a growth in the uterus. It's not cancer. But you can come, it may not give you any symptoms. Some give symptoms. And the common symptom is menstrual pain and excessive bleeding and all that. You can come and see me in my consulting room and I'll just touch your tummy and tell you, madam, your tummy looks as if you are 20 weeks pregnant. And it's growing there. No pain, nothing. It's just growing there. That's a tumor. It's not a cancer. That's what we call silent killer. But it's starting to cause you discomfort. You come to me and tell me you cannot breathe well. you can't breathe well. That is the cancer, that is the fibroid that may be the issue. It may be the issue and all that. But most times it's usually about having children that people come forward. You touch it and say you need operation. That's another story. What I will have to really discuss is the cervical cancer aspect of it, cervical cancer in women. Yes, the good news about this type of cancer is that it has a cure. Most cancers don't have a cure. I was talking about pain and cancer. By the time you start having pain as a result of cancer, just know that the cancer has grown to an extent that it is occupying space and impinging on things that will be giving you pain. So it's those things that is impinging on. Is it a medical word I use? Impinging. It's English now. Have you? Yes. Okay. Those things that is impinging on is what is now causing the pain. So cancer doesn't cause pain. And that is why it's important to be checking and screening. So cervical cancer is there. I know I've talked about it. I think I talked about it last time I came. Well, people have been hearing about it. We should know by now why the cervix is the mouth of the womb. Certain growth will just start from there. And as I said before, from the cellular level. And you will not know. Nobody will know. Until one day, you just notice that you are feeling some odor. Especially if one is a widow or a divorcee or something. You just see that you are feeling some evil. But if you are still married, what you'll be noticing is that probably you are using condom. Sorry, I will say all this in my mouth. You are using condom for family planning. And you remove the condom, and every time you are always seeing blood. Then you will still be thinking, yeah, my menses is coming. You are wasting time. Well, instead of you to come straight, you now talk to your one very close friend. You see, oh man, shame me. Time is going. At the end of the day again, you talk to her. I heard about cervical cancer. It may be that, but when you go to the hospital now, they will say, be using this thing, forever living products. Now, I'm not surprised. And then every TNT, something, everything. So by the time you now come, I now announce to you that you have stage 3 cervical cancer. At that point, I cannot operate you again. The only thing we can rely on is the cancer or the chemotherapy that we are going to give. And those things are not funny. Even you will not recognize yourself anymore. There's still ovarian cancer too, very quiet. That organ is at the back. That's where we keep our eggs. If you don't use those eggs, they will turn to something else. That's what ovarian cancer is about. And that one too, it will just be growing. You just notice that your tummy is big. Especially those people that don't have kids. They just say, Mama Adedeji, him and Toby, then try, then I'm doing sit-up, I'm doing everything. Meanwhile, the thing is growing there. Come to the hospital and all that. So what is important about cancer is the prevention. Screening. Breast cancer is the commonest. Breast cancer is the commonest cause of death in women. And what does it take to just, when you are in the bedroom, check your breasts. Press it all around. I don't need to start it. Just press it all around. Immediately you feel something. It is not pain. It is not pain. Don't give explanation. Come to the hospital and let's tell you what you do about it and all that and everything. So I think I've tried. Then endometrial cancer too. That one announces somehow. But the fact that we give explanation for all of these symptoms makes the delay and all that. So these are some silent killers. Most of the diseases that has name, most of them are silent killers. And there are over thousands of diseases. And I've only talked about less than 10 this morning. So what I've said is that let us be conscious of our health. Let us be conscious. Let us be conscious of our health. We are conscious of everything. As women, what bothers us are our children. See my friend that said she almost died. When she woke up, the first thing when she was dead, dying, what she was begging for, she said her son, her daughter, her husband. That is what we are thinking about. Added to this generation where we are becoming leaders, we are finding ourselves in places, our work. By the time we start thinking of ourselves, most times it's too late. Most times it's too late. So it just takes ourselves to put that ourselves in our calendar, in our plan, that on every birthday that I do, I'm going to go. It's not a wrong thing. It is not wrong to say that is the day I will enter one of these diagnostics laboratories and run all my tests. Or see my doctor and tell my doctor should tell me the test I should do, using your birthday as a day of memory. That's what they are doing for us in Lagos State. Those of us that work with Lagos State. We have our card, our file, that on your birthday, come and run those tests. I don't know if it's going on from one policy to the other policy as at that time. But nevertheless, at least they have brought it up in our consciousness that we should care for this body so that it will help us to have a longer span of life. So thank you very much. Thank you for this.